She will give the opening remarks. Paola.
Thank you very much, Adriana. Good morning, everyone. Thank you for being here with us and taking part of this meeting. It is an honor for me today to share a global virtual stage with more than 40 investors, especially from the Asian markets, to witness the pitches of our Colombian medical cannabis companies with their projects. In this version of the Procolombia pitch sessions for medical cannabis, 7 companies will participate with tickets between $500,000 and $9 million from the regions of Cundinamarca, Valle del Cauca, and Antioquia. We are very proud to have these projects from different regions of our country. Colombia offers many benefits for the development of the medical cannabis, including the existence of an adequate legal framework, lower production costs and lighting conditions, a good productive infrastructure, and wide availability of skilled labor, with many workers already experienced in similar or traditional fields such as pharmacology and floriculture. All of these factors contribute to make Colombia a competitive country in which to produce, export, and crop cannabis. According to FEDESarrollo, which is the most relevant think tank in Colombia, by 2030 we expect more than 1,500 hectares of Colombian land to be dedicated to cannabis cultivation, leading to an annual income of around $2.7 billion. The Colombian cannabis industry currently employs around 1,200 workers and would represent more than 40,000 jobs in 2030. Once our country reaches 100 hectares of cultivated cannabis crops, Colombia's exports of medicinal cannabis extracts and resins will be worth 17 million, exceeding exports of rubber, cocoa, and chemicals, among others. The fact that medical cannabis industry can achieve revenues of over 100 million in the short term is a very significant fact. Consider that flower exports took 10 years to exceed 100 million and almost 25 years to reach about 500 million. From our medical cannabis companies, you will see today firsthand fascinating business opportunities. To all of the companies that are here with us today, all of the success for today's event. Thank you very much.
Indeed, Paola, thank you so much. A quick reminder to the rules for today. Each entrepreneur will have 6 minutes to pitch the project. After those 6 minutes, there will be 4 minutes for Q&A. During the pitch, the investors can send questions to the chat box and we will select 3 questions to be answered in real time. All the other questions will be answered after the event via email connecting the investor with the companies. It is important that in the question you let us know the name of the investment firm or company and the city or country where you are located. Also, please don't forget to fill the investment intention form. Finally, there will be 30 seconds to answer a real-time interactive poll so you can ask for more information about a specific project after the event. To our entrepreneurs, remember that after 6 minutes of the pitch, I will kindly stop you, so please be very aware of your time. Let's begin. I am very pleased to welcome Oliver Sugel, CEO and founder of FoliuMed. The company was founded by 3 cannabis entrepreneurs from Colombia, the United States, and Germany. It produces high-margin cannabis extracts and non-smoking products for medical and health and wellness use. You can find FoliuMed in Western Europe, in Latin America, and the United States. Oliver, welcome. Are you ready?
Well, yes, I am. First of all, hello to everyone. I'm Oliver Sugel, the founder and CEO of FoliuMed. Thank you very much for having me here today. And I would like to start this presentation with a quick question, which is, if your mother suffered from chronic pain, how would you feel about her needing to smoke cannabis joints to relieve her symptoms? Smoking your medicine, whilst quite common still in North America, is very much frowned upon in medical markets where cannabis is prescribed by doctors and where doctors are understandably concerned about the harmful side effects of smoking. The second question I would ask is, to what extent would you buy cannabis from a company which cannot produce it to pharmaceutical standards? And again, the fact here is today that there are less than 15 companies in the world who can make cannabis medicine in the same way as you would expect any other prescription medicine to be made. And finally, if treating your mother would cost you $15,000 per year, how would you feel about that? And the reality here is again that cannabis medicine today pretty much is a rich man's medicine. It is not affordable, it is very expensive, and it's in part the reason why 90% of the world demand for cannabis is still being satisfied by going to the black market. And it is these three reasons which have led us to create FoliuMed 2.5 years ago and offer the following solution. Firstly, we are about standardized and ingestible products, orally taken cannabis medicines, not smokable, which permit precise dosing and ensure long-term effects. This is something I think doctors feel much more comfortable to prescribe, and it's much more easy for the patient to administer. Secondly, we are growing our cannabis in Colombia, but the actual medicinal end product is being produced strictly to pharmaceutical standards in a German manufacturing facility. And thirdly, in terms of our pricing, we offer our products on an affordable pricing scheme, and in markets where there's health reimbursement, it can be reimbursed by the health insurance companies. So let me give you a quick overview of the products we are offering as of today. It's both ingredients on the right-hand side as well as CBD, so non-psychoactive formulations in a variety of product forms. Those include soft gels, hard capsules, tinctures, and topicals. For next year, we will be introducing psychoactive medicines, which are highly purified extracts, which we are developing together with our German partners in this facility. So this facility here in Germany is 45 minutes outside of Frankfurt. It is one of the very few facilities in the world which is licensed and qualified to produce medical cannabis under true pharmaceutical conditions. The facility has been operating for over 30 years with opioid-based painkillers. And it is a facility which is audited by the regulatory authority of Germany, the USA, China, Korea, and a whole number of other countries. Getting back to the statement from before that cannabis is a rich man's medicine today, if you look at this chart, it shows the wholesale pricing for pharma-grade medical cannabis in Germany. And on the left-hand side, it's the pricing offered by the largest competitors. There's one competitor in Germany right now who owns 90% of the market for extracts. They are offering their product at 300 euros per gram and have 90% market share. But this just shows how expensive it is to produce and grow cannabis in Germany. And this is where we see a major opportunity. Our leadership team combines experience in pharma, in cannabis, and in other highly regulated industries. It's a senior team. Each one of us has over 25 years of experience. We all had our prior ventures before, and we all have worked with private equity and other institutional investors. Me personally, before I went into cannabis in 2016, I ran a publicly listed company for over 15 years. Finally, some of the key metrics for our company. So we started selling in June. We are on track to meet our 2020 sales target, which is $450,000. Our cash burn rate is $70,000 per month, so with a break even expected in the first half of 2021. And our sales projections are 65 million and 31 million of EBITDA in 2024. We raised $5 million in total, up to $5 million in total. That's the entire funding required to make this business plan. And the use of funds is for extraction equipment, R&D, and working capital. A quick side note, until now, the majority of funds have been put into the company by the founders. So we have put our money where the mouth is. And we have investors from
Oliver, we
Singapore.
have 6 minutes now, and I am very sorry to stop you, but maybe we can finish your statement during the questions time. Let's do the Q&A, Oliver. First question, where do you see the biggest risk in your plan and how do you mitigate it?
Well, we are operating in a highly regulated industry, therefore I think regulations always are the highest risk here in some form. And the way we mitigate is that we have a partner in Germany who is fully vested into our company. They own 50% of the German business. And we are operating in multiple geographies and therefore are not just exposed to one single market. That, I think, allows us to hedge against the regulatory uncertainty, which I think in this industry is still pretty significant.
Oliver, how do you justify your valuation?
Well, the valuation, the $20 billion US pre-money, is the valuation at which our investors entered last year, 2019, which was before we created and closed on the German deal. Secondly, our publicly listed competitors are trading between $50 to $70 million. And the latest announcement by Clever Leaves with regards to their own listing, using the same metrics, the same multiples they're using, would put our valuation at $35 million.
Oliver, do you have 2 minutes and 30 seconds to finish the statement that I can let you finish?
Okay, very good. So just finishing up here on why invest our company. I think fundamentally we offer the combination of two very things. On the one hand, a low-cost growing Colombia, which everyone else will do, but at the same time a world-class pharmaceutical asset, which we have in place in Germany. And the important piece is everyone can work with a contract manufacturer in a different market. Our partners are vested partner, they have owned 50% of the business, which comes out of Germany. We're in the middle of Germany and the European market, which for now I think is one of the most promising markets for medical cannabis. Asia, I think, will be the next big frontier as we see. We have a proven management team with senior people who have invested materially into the business. And we have, I think, made very meaningful progress here over the last 2 years in being fully licensed and operational, and would very much welcome having the investors join us in this exciting journey which we are embarking upon in bringing cannabis in an affordable and pharmaceutical way to a much larger population than what currently is being the case. Thank you very much for your time today.
Thank you, Oliver. Excuse me. Now let's go to the 30 seconds to answer the questions in our interactive poll. Investors, please.